Welcome to today's video, where we'll be diving deep into cortical cataracts. We'll explore what they are, what causes them, how they're diagnosed, and what you can do about them. So, let's get started on understanding this common eye condition. So, what exactly causes a cortical cataract? Age is the most significant risk factor, but other factors play a role. Prolonged exposure to ultraviolet radiation from sunlight, diabetes, smoking, and the use of certain medications, like corticosteroids, can all increase your risk. Eye injuries or previous eye surgery can also contribute to their development. Essentially, anything that disrupts the normal chemical balance within the lens can potentially lead to a cortical cataract. Now, let's talk pathophysiology, which is how the disease develops. The lens of your eye is made up of water and proteins arranged in a precise order. In a cortical cataract, these proteins begin to clump together specifically in the cortex, which is the outer layer of the lens. This clumping causes opacities, or cloudy areas, to form, often starting as wedge-shaped or spoke-like patterns that gradually expand inward. As these opacities grow and merge, they scatter light as it passes through the lens, resulting in blurry or distorted vision. Cortical cataracts are incredibly common, especially as we age. They're a leading cause of vision impairment worldwide. Studies show that a significant percentage of individuals over the age of 65 have some degree of cataract formation, and cortical cataracts represent a substantial portion of these cases. This underscores the importance of regular eye exams and awareness of risk factors. What are the signs and symptoms of a cortical cataract? Initially, you might not notice any changes at all, but as the cataract progresses, you might experience increased glare from lights, especially at night, difficulty seeing in bright light, blurry or hazy vision that can't be corrected with glasses, halo surround lights, double vision in one eye, and changes in your perception of colors. These symptoms can significantly impact your daily activities, making it difficult to read, drive, or even recognize faces. How are cortical cataracts diagnosed? A comprehensive eye exam is crucial. An ophthalmologist will dilate your pupils to get a clear view of the lens. They'll use a slit lamp, a specialized microscope, to examine the lens for any opacities or clouding. Visual acuity tests, where you read letters on a chart, will assess the impact of the cataract on your vision. Other tests may include glare testing, contrast sensitivity testing, and retinal examination to rule out other potential causes of vision problems. Cortical cataracts are often described based on their location and appearance. You might hear terms like water clefts, referring to clear areas between opacities, or radial spokes, describing the wedge-shaped patterns. While there aren't strict classifications, understanding the morphology helps the ophthalmologist track the cataract's progression and tailor treatment accordingly. Remember, the lens has anterior, posterior, and equatorial areas, so a cortical cataract can be anterior, posterior, or equatorial, referring to its location on the lens. The primary treatment for cortical cataracts is surgery. When the cataract interferes significantly with your daily life, cataract surgery is generally recommended. This involves removing the cloudy lens and replacing it with a clear artificial lens, called an intraocular lens, or IOL. The procedure is typically performed on an outpatient basis and has a high success rate. Non-surgical management, such as updating your glasses prescription, might provide temporary relief in the early stages, but surgery is the only way to permanently correct the vision problems caused by the cataract. While you can't completely eliminate the risk of developing cortical cataracts, there are things you can do to reduce your chances. Wear sunglasses that block 100% of UVA and UVB rays to protect your eyes from sun damage. Manage any underlying health conditions such as diabetes. Quit smoking. Maintain a healthy diet rich in antioxidants, vitamins, and minerals. And, most importantly, schedule regular eye exams to detect cataracts early and monitor their progression. The prognosis for cortical cataracts following surgery is generally excellent. Most people experience a significant improvement in their vision after cataract surgery. Recent advances in eye technology, such as multifocal and toric lenses, can even correct for presbyopia and astigmatism, further enhancing visual outcomes. Research continues to explore new ways to prevent and treat cataracts, including investigating the use of antioxidant supplements and developing non-surgical treatment options. Remember, early detection and appropriate management are key to maintaining good vision throughout your life. Thanks for watching.